When the four pillars approach was launched, really the police were in the best position to do something. They were fully funded, they were already very active, and although we had sort of sought this balanced approach, the first thing they did was launch a huge crackdown, which involved trying to really address the public disorder problems. And that was evaluated by us through a number of ways, including this ethnography by Will Small. And really we found what you found here with your evaluations of similar activities. We found widespread displacement of drug users. These activities actually helped to seed new drug markets in other parts of the city. We saw increases in risky injecting, reductions in access to sterile syringes, and a lot of frustration experienced by many outreach workers and healthcare professionals who could no longer find the people that they had worked hard to establish relationships with. Unfortunately, the police were also positioning their cars outside of various low-threshold harm reduction programs, such as this one, and would arrest people directly out front. Not surprisingly, our evaluations showed that when we looked at before versus after crackdown like Operation 24/7, we saw very large and significant declines in the number of syringes that were being distributed in the neighborhood. Just going back a few years, I think it's important to note that harm reduction didn't really start out very well in Vancouver. This is a now famous study called Needle Exchange is Not Enough. It was an early study of the outbreak, and what this study reported was a simple cross-sectional association between being a frequent needle exchange user and being HIV positive. It's now cited throughout the world as being a study that somehow proves that needle exchange causes HIV infection. So one of our first tasks, and certainly in Vancouver as well, this led to all kinds of headlines such as needle exchange doesn't work, despite the fact that needle exchanges are now endorsed by virtually every major medical and public health body in the world. But we were very interested in trying to unpack this problem and find out, well, how did Vancouver experience this explosive epidemic of HIV in the presence of a very large needle exchange? And when we looked at predictors of high-risk syringe sharing in this setting, what we found is that people who reported difficulty accessing syringes were over 3 times more likely to share syringes. We then looked at the reasons for difficulty accessing syringes, and one of the factors that people most commonly cited was that the needle exchange was closed. The needle exchange at the time had such pressure on it from business improvement associations and neighborhood groups to recover as many syringes as they distributed and to not contribute to disorder in the community. Sadly, they had this crazy idea that if they closed the needle exchange at 8 p.m., they could somehow denocturnalize the entire downtown east side, like the party would just stop because the needle exchange was closed, which I'm sure, as you can appreciate, when your drug of choice among most injectors is cocaine, you could see why this would be hugely problematic. Also, problems were a number of restrictive policies. For example, you had to have a needle to return in order to get one. They weren't giving out loaners, that kind of thing. So fortunately, we worked very hard with the Regional Health Authority to try and share this data with them and encourage them to redesign their needle exchange, and to their credit, they did. Importantly, they decentralized and expanded the needle exchange. Every health clinic in the area began distributing syringes, and they also began to involve drug users in the distribution of syringes through a variety of mechanisms. They moved away from a focus on exchange towards a focus of distribution. They expanded the number of sites and methods used for distribution, including foot patrols. They removed the limits on the number of syringes that could be obtained, so people could literally grab hundreds of syringes at a time. They removed the restrictive one-for-one exchange rule. You didn't have to have a used rig to get a new one. And very importantly, they separated distribution and recovery functions, so the people distributing syringes no longer had to worry about recovering them. We recently evaluated this in this paper published in the American Journal of Public Health, and here you can see that the period of policy change was associated with large declines in syringe boring, which persisted in a multivariate model, as well as large declines in HIV incidence after adjusting for changes in drug use patterns and other known risk factors. Also, quite central to the response in Vancouver has been drug user activism and peer-driven interventions. For example, when right before the framework for action was developed, a local neighborhood group supported by a number of architects who really wanted to gentrify and redesign the downtown east side lobbied the city council to declare a moratorium on the creation of new programs for drug users. So Vandu responded by delivering a coffin to City Council, and they erected crosses all over the lawn of City Hall, and the moratorium was immediately lifted. But they also really helped extend the reach and effectiveness of local public health programs by going to places where other public health workers weren't going. So for example, they would go at the wee hours of the night in the morning and make contact with the highest risk injectors in the alleyways to provide them with sterile syringes, first aid. They were all trained to provide emergency response in the event of overdose, etc. They also very early on erected a exchange tent right at the corner of Main and Hastings that opened the minute the fixed exchange closed. We subsequently evaluated that to compare people who were and were not accessing the Vandu needle exchange tent, and we found that the people who were visiting it possessed markers of risk for HIV infection, people who injected in public, and they were also helping to encourage safer syringe disposal. And we've seen similar benefits for their alley-based patrols.